And we're live. Hi, and a warm welcome. We're so excited to see you today for the Healing Healthcare Authors Tour with your hosts, Dina Redinger and Sharon Weinstein. We are the co-authors of the book, Healing Healthcare, Evidence-Based Strategies to Mend Our Broken System. Nurses remain the backbone of healthcare, and little has been done or even studied to remedy our system in crisis. We're ready to address it with our contributing authors, and we're ready to start that process now. This book is packed with solutions to the problems that plague our healthcare systems. And these are the problems that really do trouble nurses, that take them away from the profession. In the book, nurse leaders share their experiences, their thoughts, their evidence, and their strategies to ensure the health of our healthcare system. We must get this into your hands and into the hands of everyone who has an impact and an interest in healthcare today. Dina, over to you.
And I am super excited to introduce your first interview, our first author, Dr. Enoh Ukpong. Welcome, Enoh.
Welcome to the show.
Thank you very much for having me. I appreciate it.
Yes, we're welcome. So excited to have you. And we want to just acknowledge the things that you have done over your lifetime, anywhere from entry level through all the stages of the workforce. It kind of opens up that series of our book and that excitement for what we've got. You're a CPR instructor, a nurse, midwife, an academic, educator. You've been around this world almost 50 years. So we want to just acknowledge you. You've earned your bachelor's and master's degree at Anna Marie College in Paxton, Massachusetts, and her terminal degree from Columbia Pacific University. She's also a self-published author of the book, Joy Comes in the Morning. It's a power of drive, discipline, and determination, and it is available on Amazon if you want to read it. I've read it. I think it's an amazing book. So welcome, Enoh. We can't say thank you enough for joining us today.
Thank you so much for having me. I appreciate it.
Yes, and we want to start off with that first question, Enoh. In your first chapter of this book, you specifically talk about that functional healthcare system. And we'd like to understand, what do you mean by a functional healthcare system, and how do we create that?
A functional healthcare system is where the workers, the people we serve, are happy with our services. If you do not have a happy healthcare team, they're not going to do a good job. And the people that we serve, which is our clients, will not be happy. So it is very, very important for us to create an environment that is conducive for the workers so that they can deliver the care that our patient needs. For me, that is very, very important.
Yeah, what is the key thing that you think leaders need to be doing that they're not doing to create that functional healthcare system?
Leaders need to be attentive to their workers. They need to listen to them. They need to be there when their workers need them. A lot of frustrations in healthcare system is the leaders not listening to what the workers need. And unfortunately, with the kind of services that we have, when the workers are not happy, it does affect their productivity, which is the patient we care for. A happy worker is going to make a happy patient, is going to make a happy company. So it is very, very important for our leaders to be attentive to the need of our workers so that we can give satisfactory care to our patients.
Wow,
Yes.
so active listening is really the first key. If the leader is not listening, and not just listening, but actually taking action to implement some of the suggestions that come their way, to initiate some of the changes that are needed, nothing will ever happen, and we cannot be functional. Isn't that right?
Right.
Yep. And we talked
Right.
about this too, a little bit earlier today. We talked about the things that are not spoken. Listening, there's levels of listening too. And we talked about the intentional listening. And I think you kind of shared even a little bit more about the fact that, there are things that we have to start asking some of those right questions and really understanding what is not being said, what are the needs that we are not completely aware of. And that goes back to what you're saying is really that deep listening. So thank you for that. So Sharon, you got another question for Enoh?
I do. We're amazed. You bring such an unusual background to nursing, having worked in so many roles. Please tell us about that. And what was the impetus behind that move to just take your career trajectory to a whole new level?
Having been in healthcare for 49 years, I have been around a lot in many areas. At first, when I finished registered nursing and midwifery in Nigeria, my aim was to go further. And the Nigerian government would not let me go when I wanted.
Oh,
That was the only reason why I left Nigeria. If I had waited to go when the government wanted it, I would have gone free. I didn't mind the price for what I want when I wanted it. So that was one of the reasons why I came over. When I came over here, I had worked as a nurse's aide while waiting for my Massachusetts license. Then I took an LPN exam and worked as an LPN. And finally, in 1981, I got my registered nursing certificate here. That same year, I graduated from my bachelor's in nursing. And
wow. Okay.
I went straight after my bachelor's into my master's. And then I never stopped. I just continued. I think what really pushed me is my childhood upbringing. For those that have read my book, I was abused as a child. And at the age of 13, I understood what freedom is. And I understood that the only way I could gain my freedom for the rest of my life was good education. Well, that set me on fire for schooling. Nothing will stop me. So, having been in all these places, different roles, it makes me sensitive to healthcare. When I was nursing administrator at St. Vincent Hospital, I was in charge of staffing for the whole hospital. And that really was an eye-opener for workforce. When you do not have a flexible schedule for people who are in different stages of their lives, when you do not listen to the people that are working for you, when you do not compensate them adequately, it makes for miserable work setting. And that is not good for our patients, not good for the staff, not good for anybody.
Right.
So I feel to make a difference and to make it attractive, we need to pay attention, compensate people adequately, and be sensitive to their personal needs, which affect their scheduling. For example, when I started, I had little ones, so I had to work nights as long as till I dropped my last one off to college. That was when I actually shifted into teaching. All these things does have impact on your workforce. So not only teaching, I had to go for recruitment in high schools.
Mhm.
It was awesome. At that stage in people's life, a lot of the kids don't even know what they want to do. What I did in going to high school to talk to them about healthcare was to open their eyes and give them the option and the knowledge to make choices. I did gain a lot of students from high school, and that was phenomenal. And having been teaching for the past 24 years
Mhm.
in multiple colleges, I have produced so many students. It's not even funny. Any healthcare institution that I work in, they will recognize me. I don't recognize most of them. But I am thankful that I have been able to contribute in a positive way to healthcare, because having been in all these positions opened my eye to the needs and how to take care of our needs.
Love that. I
Well,
love
you
that.
certainly have contributed to that gap. Dina, back to you.
Yeah, so I want to ask you a question. We're past post-pandemic. What do leaders need to be thoughtful of besides listening around post-pandemic healthcare as it rests today? Give a pearl of wisdom for that leader that's sitting out there, something that they must be very mindful of right now.
A lot of times people think because we are in healthcare that we know how to take care of ourselves. Unfortunately, a lot of healthcare workers don't do that. They don't even think about that.
Mm-hmm.
If they were to think about that, a healthcare worker wouldn't be smoking. They wouldn't be drinking. They wouldn't be doing drugs, things that hurt them. It was not only before or during the pandemic, but it got worse during the pandemic.
Mm-hmm.
With the stress of increased volume, very sick people, precautionary task used to keep people safe, makeshift hospitals, the healthcare system was overwhelmed. I am so thankful to God. We got through it and we are where we are today. But the impact is still there among the healthcare workers.
Mm-hmm.
There is increased mental health in healthcare profession because of that. Right now, to book an appointment, you book appointment, you cancel, it's almost impossible to rebook it because the healthcare is still packed.
Right.
We've shifted to telehealth instead of going in person to see your doctor. All these things makes us appreciate what we had before, but we have to make room. We have to make changes to accommodate the new world that we are in. Pandemic is not over.
Right.
COVID is not over.
Right.
It's now endemic. It's not going anywhere. So we still have to be careful and be cautious.
Right.
But I'm thankful to God that something has been done that has actually controlled it to where we are today.
Right. Yep. It's kind of like what you said. It's really not over. I mean, we're still feeling the effects of that, suicide, depression, all of that. So being mindful about the healthcare of your workforce is incredibly important right now, especially because we're still dealing with it and it's going to be there for a long time.
Yeah.
Yeah. Back to you, Sharon.
Yeah, sure. Thank you for that. What I took away from that last piece was if you don't take care of yourself, you can't take care of others. So all good. Thank you for that. We appreciate it. That brings our program to an end. I want to say that it's time for a close and an invitation for all of you to join us next week on LinkedIn Live for the next contributor of the week. We want to take this opportunity to thank Dr. Enoh Ukpong for joining us today for being chapter 1 in healing healthcare. She gets us off with a great start and carries us on with an impetus that just really does bring the book to life. You will all glean very important messaging from our book.
Yep.
And we hope that you will also glean the same type of an experience from our weekly calls. Thanks for joining us today. And thanks to Enoh for being our guest.
Thank you.
Thank you so
Take
much.
care, everybody.
I wish you all a very happy Easter.
Thank you for
Enoh.
that.
We appreciate you.
You're welcome.
Thank you. Take care. Bye-bye.
Thank you. Bye-bye.